Thank you for downloading Children's Pedcast, a conversation about pediatrics with Children's Minnesota. My name is Jimmy Bellamy, and this week my guests are Doctors Gigi Chawla and Mike Troy. We discuss early childhood development and the development of the infant-toddler brain from ages birth to 3 years old, and the importance of that time. 80% of the brain is developed in that period of time, and a lot of questions come from parents about what is best to use in those times. And the answer really is, it's you, the parent, who is the best tool for the child, more so than the latest and greatest technologies and games. We talk about what's needed to raise a healthy child, especially in those early years. And we talk about things that maybe aren't as helpful, or the things that are. We also have an early childhood development campaign that can be seen at amazingiz.org, where you'll find a lot of information and cool things pertaining to the infant-toddler brain and early childhood. You can find us on the web at childrensmn.org. We're on Twitter at childrensmn. And find our podcast on iTunes by rating, reviewing, and subscribing. Thank you, and enjoy this episode with Doctors Gigi Chawla and Mike Troy. We've been learning a lot and talking a lot about early childhood development, and one thing that I constantly hear is about the significance from birth to age 3, what that means for the development of the brain. Why is that so significant?
Well, one way to begin talking about that subject is to consider the fact that a tremendous amount of brain development occurs during that period. In fact, the vast majority of the proliferation of neurons and pruning and organizing of dedicating areas of the brain to certain kinds of responses and skills, all of that is being done, or much of that is being done in those first 3 years of life. In fact, even in the first year of life, before we have memories, before we can talk about it in terms of our own experience, incredibly important things are happening at the level of brain development.
And the question I come up with then is there, does it reach a point of no return beyond 3? Are there things that are irreparable as far as we know?
Well, two points to make in regard to that question, Jimmy. One is I said that a tremendous amount of brain development is happening early in life. What I didn't say is that it's happening in the context of relationship. That's really the key for us as humans. That the social brain gates all the learning that occurs, and it even gates the wiring and development at the physiological level. The reason that's such a dynamic and important period is because there are sensitive periods when certain aspects of development are in play. So, for example, right after birth, sensory motor development, orienting, regulating physiologically, these things are the most sensitive and are being wired in. After that is language development. So nobody teaches a toddler how to speak. They experience a social world in which there is speech, and their brain wires for that, and it's really quite a remarkable story and amazing. And after that, there's a sensitive period for things like self-regulation, emotional control, recognizing expressions in other people and what they mean, and whether that's comforting or threatening, and the ability to control one's own behavior. That becomes a sensitive period. As each of those periods opens, it's a time of maximal opportunity. And as they close, which they need to in order for us to sort of keep developing in more complex ways, it becomes more difficult to make changes. It's not impossible, but you've changed the probabilities in terms of how easily that can be done the longer that we wait.
What are some components that go into the healthy development? And conversely, what are some behaviors or examples of unhealthy development?
I think, as clinicians, when we're looking for what are the aspects of healthy development, like Dr. Troy was mentioning, it really is done in the context of how is that child, that infant, bonding with their caregivers. And the things that we're automatically looking for right off the bat is what is their bonding, what is their relationship? Are they looking at each other? Is that parent, that caregiver, a source of immediate comfort for a child? Do they look back and forth at each other before the child turns away and starts to explore other aspects? So it's what we're really looking for in terms of healthy development is that bonding, that attachment, that reaffirmation that a child is making progress and doing the right things and exploring and learning about their world. I guess when we're looking for unhealthy development, some of those things are pretty easy to see immediately. I think, anybody who's been at a grocery store or a Target or something like that, where you can see the parents who are really struggling with their kids, and some of that is really normal tantrums and such, but others it's pretty typical to see things that we would choose to say there are other options or other ways that we could have crafted a relationship or helped guide a relationship to be a more positive and reaffirming one for a child.
We know that babies and toddlers reach milestones at different times, but in general, there's kind of that area where they can, what am I trying to say? There's that area or range where they hit it. Are there any signs or symptoms or indicators that a parent needs to look out for that, hey, this might mean my kid isn't on track, that reasons that they should be concerned and maybe check in with their doctor, pediatrician?
Yeah, I think, unfortunately, a lot of those things come across as physical complaints, not necessarily as, I don't think my child is developing well, although, there may be some of those issues like, I don't think my child's sitting when he or she should be yet, and that could be signs that they're not engaging with their parent and practicing sitting or practicing some of those developmental progressional steps. But I tend to think of parents reaching out in terms of gosh, my child's really irritable, or really just fussy, or my child doesn't sleep, or they're not eating the way I thought they would, or generic physical complaints that actually probably taking a step back or with a greater lens might be more along the lines of, is the parent and child bonding in a way and allowing the child to develop in a way that's a reassuring and reaffirming environment in which the child can take those next steps and progress.
With each decade that passes, it seems that when it comes to parenting, when it comes to being side by side with your child and helping their growth and development, more and more toys are involved, more and more gadgets are at play. It can be stressful for parents. It can be a burden on wallets. Is this something parents should look for as far as getting the latest and greatest, or are there other things that they should be doing, like encouraging the play that can take place without the help of some kind of new tech item?
Boy, I think honestly this is an issue that comes up every day in my practice, is that families are looking for the newest, greatest toy or educational platform or material in order to help their child develop and stay on track and be amazing. I mean, they all want that. And I think a lot of those new innovations and toys are designed in really to try to build towards that concept. But, taking a step back, that's, like Dr. Troy was saying, that's actually not necessarily how kids in the early years are really meant to grow and develop. They're really meant to grow and develop in the context of a relationship, a secure emotional, physical relationship with their caregivers in a way that introduces language and emotion and all of that is positive. And whether or not you bring in, the newest, greatest toy into that, but it's still all about the learning environment and emotional connection that is between a caregiver and a parent. And the truth is that the easiest way to do that are the things that are not gadgety and going to take away that, pull attention away from a parent or caregiver to this other fancy item. It's all about looking at things like books or singing or, having some of those really more physical and engaging connections that when you see a child doing really, really well in that environment, they're looking at a book, they're actively involved, and they look back at their parent and they're engaged in how is my parent interacting with that book also, and is it a safe and amazing opportunity for that parent too to teach and engage.
And that seems to also encourage imagination and creativity, which usually helps out with that development too, as far as setting you up for years later.
Yeah, I think that's a great way of thinking about it. It's really, hard to be imaginative with the newest and, greatest toy because the manufacturers have decided how that imagination is going to go, right? I mean, they've dictated where that toy is going to take you. Versus when you're doing things like singing or looking at a book, as a caregiver, you can take that wherever you want and wherever the child wants. It's a very different engagement.
And another way to think about it, or an additional way to think about it, is to kind of go back to some of those earlier questions. How do we know development is on track? What are the signs that things are progressing as they should, or that there are concerns? And each of those questions is dependent on what is developmentally important at a given point in time. So when it comes to sort of what sorts of play materials, are helpful and useful, the question can only be meaningfully considered if we understand what is online in development at that period of time. So what's most important in the first year of life? It's the interaction between the primary caregivers and the infant. Anything that facilitates that, like Dr. Chawla said, a simple book that has a rhythm and is delightful to the person reading it, becomes a good tool. It doesn't have to be that, but that's a good tool. Anything that gets in the way of that interaction, that interferes with the attunement and sensitivity between the caregiver and the infant, is actually hindering development. As kids become toddlers, more complex sorts of activities where they are maybe building and stacking and then things fall down, and now they have to learn to manage the frustration of that. Do they think it's funny? Do they have difficulty recovering if they're upset? How does the caregiver help them in that? So the materials become secondary to the tasks and issues that are in play at a given developmental period. So those principles of developmental change and of interaction with the infant or child and the caregiver and the environment come first, and materials come second. If they add fun and delight, then that's great. But they're not doing the teaching and they're not driving the development.
Technology inevitably gets integrated into our lives. What should parents look for and what shouldn't they do as far as incorporating that technology into their child's lives?
As far as screen time, for example, kids who are under the age of 1, baseline, don't need any screen time. What they need is their parent and their caregiver. So kids who are older than that, the American Academy of Pediatrics has said that really we want to make sure that kids have less than 2 hours of screen time per day. And so we're looking for ways to incorporate learning without screen time. And it gets to be really difficult, I think, for families and kids of like childhood age to imagine how could that even be possible anymore. but it is possible. And so trying to find some of those mechanisms really to reconnect with kids is really important.
One of the hard things that parents have to do sometimes is limit their own use of media. And so, at the point at which a parent is using a device to distract a child so they can be on a device is, at times and now and again and so forth, we do what we need to do as parents to, get through the day. But we should know that's what we're doing, and that everything developmentally meaningful in 0 to 3 that occurs in the context of an actual human interaction, not a video, and not virtually. We're not wired that way. So parents sometimes need to do what's hard for them, which is limit screen time when they're with their infant or toddler.
I actually wish, Dr. Troy, that you would talk about there was a study about language and how language really evolves, like you were saying, in the context of a person and not even a virtual person.
So we talked early on about sensitive periods and how exposure to the environment drives brain development. And a beautiful example of that is language development. How is it that we learn whatever our first language is, or multiple languages if we grow up? It's actually being wired in between about 6 and 12 months. And even minimal exposure to someone that speaks a given language will begin to wire the brain to produce the sounds necessary for that language, to develop the pattern of the rhythm of that language, and so forth. And there's a wonderful study that Dr. Chawla is referring to that shows how infants in Berkeley, California, just over the course of a dozen sessions or so, in the sensitive period, exposed for 30 minutes at a time to someone that speaks Mandarin, and at 12 months, their ability to recognize the distinctive sounds of Mandarin is the same as an infant raised in that language. They replicated the study, but having the same speaker sing the same songs and read the same books, but on a screen, and had absolutely no effect whatsoever. So it wasn't the language alone; it was the language mediated by the actual physical social interaction.
There's that connection taking place person to person that is removed when a screen is put in front of it.
And something is happening, all kinds of subtle biologically driven processes in that interaction that are quite amazing, that can only happen in person and can only happen between a caregiver that is sensitive and attuned to that infant.
That's exactly the type of study that I try to highlight when I'm talking with parents about their use of iPads or videos or even PBS to help teach their child and their infant about the world, about language, about colors or shapes or anything like that. Because I think that is just so powerful that people need to understand. It's that material that they see on a TV or on a screen or through another electronic device, it isn't actually being laid down for learning at that age Unless it's done through and with their loved one, their caregiver.
That's right. That's exactly right. The point isn't that they saw a new letter on Sesame Street. Correct. The point is that then the adult can say, hey, remember when Cookie Monster was talking about letter C, or it's just like, or they sing the song that they heard? So it becomes material for the interaction, and not the what happened on the screen alone, but it becomes part of the play and part of the rhythm and part of the talk between the caregiver and the infant.
Gigi, you're involved in the Cradle to K Cabinet. I want to talk about the city of Minneapolis's effort to reduce the word gap and why it's important. And tell us a little bit about this Talking is Teaching campaign.
Yeah. Oh, thank you for asking. So I think, to talk a little bit more about how important that early period is in language development has been something that Mayor Betsy Hodges for the city of Minneapolis has really understood as being a key piece in making sure that kids academically are successful once they do hit the school age time period. And what we know about this concept of the word gap is that by the time kids are 5 years old and going to kindergarten, there can be as much as a 30 million word gap of words heard between kids who have grown up in an environment in which language is really vital and an important part of their development, as compared to kids whose language has an environment hasn't been as supportive of that development. And so, in really trying to figure out, well, how do you tackle this? Because once kids hit kindergarten with that 30 million word gap, there is no way that the school systems or thinking about how do you catch kids up, what's that achievement gap look like, can honestly make that much of a difference. The work really has to happen and should happen, because that's when kids and their brains are doing the most development, should happen before that time. And so, she's really visionary in this and gets the science, thankfully, and gets how kids and development, where our learning opportunities are for parents and for the community of Minneapolis. She's really put together this cabinet called the Cradle to Kindergarten Cabinet, in which we're really looking at how can we as a community get kids off on the greatest start, so that they're everything after that point can be about how they can be more amazing, not on a catch-up schedule. And so this part of the work on the Cradle to K cabinet, we've partnered with the Clinton Foundation to really look at a platform called Talking is Teaching, in which talking, singing, and reading to your children, just the easiest and most basic things, could be really a campaign that we've set out across all aspects of the community, where she's really reaching out to parents and caregivers, to freestanding daycares, and to in-home daycares or family, friends, and neighbors who really take care of kids. We're also looking at, well, how does the city support that work by doing things like, when families are in places like laundromats, or waiting for the bus or on the bus, how do we make each one of those areas within our community a place where learning and language is fun? And so even things like helping families become creative and stimulate some of that imagination by, at a bus stop saying with triggers to help remind families, talk about the bus, talk about what you're seeing, talk about what wheels do, talk about colors and shapes, and all of those things that instead of families turning to their phones and, looking and keeping themselves busy that way, engage. Those are just a few minutes each day to engage your child. It doesn't take very much, but just a few minutes each day to engage your child on the world around them.
With the Talking is Teaching campaign, we will be sharing materials throughout the coming months, providing those ideas. If people do have concerns or maybe need a little bit of a boost in coming up with something, look at our social media channels. Find us on childrensmn.org, find us on Twitter, Facebook, and we'll be sharing a lot of great visual items for people to use with their families. About reading, singing, identifying animals, lots and lots going on. So look forward to that. Is there anything else parents can do if they have any concerns?
Well, one thing I like to remind people of is that in our society, I think our pediatric providers are the developmental sentinels. That they're the folks that are working with parents from the very beginning of the child's life, and that trusted relationship and that view over time is invaluable and irreplaceable. So if parents have questions or concerns, that's always a wonderful place to start. sometimes parents are concerned simply because they don't understand what should and shouldn't be happening at a given point in time, and that's a wonderful place to get information, to be sure. And if there are concerns or there are delays that need to be monitored, then again, that can be done over time by the pediatrician. So I'm a big fan of that as a first resource.
Thanks, Mike. I think the other thing that I wanted to bring up is something that Dr. Troy always teaches me, so I hope he'll expound on this just a little bit. But, you know, I think it can be really stressful, right, to hear all of this and turn it back on to parents and say, yep, it's all you. You know, put away that phone, put away that newest and greatest toy. It's all you. You've got to do the work. And that can be really daunting to hear. And I just want to make sure that families realize it really isn't just about that sole parent. We weren't meant to be raised as just, you know, sitting at as a infant and a single mom or, you know, an intact family unit in just your apartment. People were raised and have always developmentally supposed to be raised in a village, and so reach out to people around you. Your child isn't meant to only learn from you; they're meant to learn from the people that you trust and love too.
That's right. You know, one way we say that is, you know, we're a very resilient species, and we've evolved to thrive in all different kinds of environments. The one thing that all these have in common across the world and across history is a larger network of relationships of others that have gone before, that have raised children and can advise, and that allow healthy relationships of the caregiver, because that's an important part of being available and responsive to the infant and the child. One of the wonderful things about development from infancy through young adulthood is that it's characterized by qualitative change or transformation. It's not just learning more information, but it's really changing in an unfolding, remarkable way. And when we talk about stages, you know, we may give a number, like by 6 months, by 2 years, by 3 years, and those are important markers, but they're not hard and fast timelines. So I like to think about the passage across those stages. Rather than like passing through a gate, it's more like moving through a chute. Mm-hmm. And exactly when a child enters that chute and how quickly they move through is mainly just individual differences between kids. And in the extreme, it may be meaningful, but most of the time it isn't. So if somebody's nephew was walking at 9 months and your child's not walking at 10 months, it probably doesn't mean anything. Mm-hmm. And so it's not a hard and fast line, but a range of time.
Dr. Chawla, Dr. Troy, thank you very much.
Thank you, Jimmy.
Thanks for having us.